Hello, everyone. We'll get started in a few minutes, but while we're waiting for some other people to join, let's get to know who's here today. And you should see a poll on your screen shortly. And the first question we want to find out is we want to get a sense from the audience of what program tracks do you teach. So you should see 4 options. The first one's pre-licensure, so that could be LPN, BSN, really any if they haven't passed NCLEX. Next one is RN to BSN, so they've already passed NCLEX, have their RN, but are going back to get their BSN. And then we'll see if we have any graduate folks. And again, there may be some other people that join us today that don't really fit in any of those categories. All right, let's take a look at how people respond to this first question. And you should be able to see the results on your screen. So most people, and that shouldn't be probably too big of a surprise, are pre-licensure, but we do have a significant amount of other faculty and partners joining us today that are RN to BSN, and there's also a lot of other graduate folks. And I'd be curious to hear some of the other programs under the other column that don't really fit into those 3 categories. I'd be very interested to hear what those programs are. And we'll do 2 other quick questions and then we can get started. Again, as the last few folks are still trying to join. So let's look at another poll that looks at people's experience with Shadow Health's digital clinical experience. So for example, if you're exploring, so that means maybe you don't really know that much about the DCE or Shadow Health, you might best fit into that category. If you're a newbie, you're using Shadow Health for the first time, maybe you're an up-and-comer, so you have 2 to 3 semesters of experience, or possibly you're a grizzled veteran and you've been doing this for 4 more semesters. So we'll give some people to respond to that. And let's take a look. And you should be able to see the results on your screen. So the majority of the people here today are just exploring. So maybe they're not super familiar with Shadow Health, but they might learn more today, and particularly, again, about how it could apply to QSEN competencies. And then we've got about another 5th, it's their first semester, and then we have a few seasoned users here that view Shadow Health a lot. And the last question, well, again, the last folks are joining and getting their audio set up before we'll start, is what is your experience integrating QSEN competencies into the curriculum? So same type of categories. Maybe this is you're just exploring what that might look like in your program if you're to more explicitly integrate QSEN into your curriculum. Maybe this is your first semester doing it. Maybe you've been doing this for a while. And again, I'll be interested to see who we have here today. All right, we'll give people about another 10 seconds to respond, and then we should be able to begin shortly. All right, let's take a look. And you should be able to see the results on your screen. And it looks like, again, most people in terms of the integrating QSEN competencies into their curriculum or courses, looks like, again, a slight plurality are still exploring. And then if you look at some of the other categories, it looks like we've got some seasoned faculty here today who have been integrating those QSEN competencies for a while. So it's nice that we have a really good mix. I think that will lead to some really neat questions at the end. And now it looks like we have everyone has their audio set up, so we can get started. And today we're exploring how virtual simulation learning can really, like things like Shadow Health, can really help achieve some of the QSEN competencies. And my name is Chris Fry, and I'm the Director of Training here at Shadow Health. And we appreciate you joining us today. And I'm pretty lucky. I have a great job where I get to work with other faculty integrating the technology into their courses. So that's primarily what I help faculty do. Now, during this webinar, you'll notice that you're automatically muted when you come in. And really what this does is it helps prevent some of the entertaining situations of hearing the background noise of 80 different people, they're barking dogs, and any of your students complaining about the price hike of Netflix. And so that's going to help reduce that, so it's a lot easier to listen to. But just so you know, you can ask questions throughout the webinar. And you'll notice on your screen, there should be on the GoToWebinar panel on the right-hand side, there should be a little box where you can type a question. And so throughout the webinar, you can make sure if you have any questions while the presentation is going, that you can type your question there just so you don't forget later. And then we'll make sure to address it in the question and answer session after Dr. Altmiller's presentation. And also toward the end, if you wanted to actually speak your question, you can think of it like a little bit like a call-in show. At that point, you could raise your hand and we would call on you so you could verbalize your question that way if you prefer doing it like that. But let me introduce our keynote speaker, and I'm proud to present Dr. Jerry Altmiller. And by the way, you can call her Jerry, that's her words. And she's an associate professor at the College of New Jersey, and she's also the director of the QSEN Institute Regional Center there. And she's also the leader of the academic task force for the QSEN Institute. And again, her presentation is going to look at exploring this potential link to where virtual simulation can really help achieve these QSEN competencies. And let me just make sure, Professor, if you can hear us okay? Can you hear us all right?
I can.
Great, you're coming in loud and clear.
Can you hear me?
Yes, you're coming in loud and clear. Great, you can take it away.
Okay, so we're going to start off, Chris, if you want to move to the slide with purposes and objectives. I'd like to welcome everyone for joining us this afternoon. Today we're going to talk about QSEN in nursing education. We're also going to discuss virtual learning strategies and the QSEN competencies. And then we're going to talk a little bit about planning for the future in nursing education. So you can move along, Chris, to the next slide, that is the overview. So a lot of you know about QSEN, but I'm just going to give you a very brief history about it. It's been 12 years since the introduction of QSEN, and QSEN is really an organization that started as a grassroots movement. It came from work done by the IOM, which is now the National Academy of Medicine, and they developed 5 competencies that all healthcare providers needed to have. The QSEN group that began this work took those 5 competencies, added a 6th, which was safety, and then they developed knowledge, skills, and attitude statements that align with each one of these competencies. And this is where the QSEN competencies originated. So the whole idea of this work is that we
Hi, Jerry, sorry to cut in.
Yes.
But, it sounds, some people said the audio just went a little bit fuzzy for a second. And
okay.
I think you're on your phone. That sounds really good. If you just put it closer to it sounds like it just changed a little bit to be more clear.
Oh, okay. Can you hear me very well
better
now?
Yes, that's noticeably better. Perfect. Sorry, go ahead.
Okay. No, that's okay. I'm glad you stopped me. Okay, so the whole idea of developing the QSEN competencies was really about creating an individual nurse that reflects a new identity of somebody who is not so much task-oriented, but demonstrates knowledge, skills, and attitudes that emphasize quality and safety in patient care. So since this grassroots movement beginning 12 years ago, it has really blossomed into being very relevant to nursing education and clinical practice. So Lyle Edrizzolo, he did a crosswalk that showed QSEN along with the magnet standards, along with the Joint Commission standards, and showed that they all flow together very well. So now QSEN is part of pre-licensure education in almost all programs. Whether you are accredited by CCNE or CCEN, it is part of the accreditation standards. It is part of baccalaureate essentials, part of master's essentials, and it has been integrated into transition to practice programs. So QSEN needs to be the underpinning, and that's the point that we're going to talk about today, that a lot of people think about it as a piece they need to add or something that they've got to include in their curriculum as a separate entity. But truthfully, it's something that you weave throughout what you already do and use it as an underpinning in what you teach. So if you can move to the next slide, Chris. One more from that so you catch up with me. So we're really thinking about a paradigm shift here, that we're moving from that task-oriented education, teaching a student how to put in a Foley and how to put in an NG tube, instead to thinking more globally about how can I do this work more efficiently and more effectively. The way that I try to emphasize this with my students is to tell them, you not only need to learn how to do your job, but you need to learn how to always be thinking about how to do it better. So I not only need to do my job, I need to always be thinking about how to improve on it. So on this next slide, when we think about QSEN competency implementation, we know what the competencies are. They're listed there down the left-hand side. But we know that there's great challenges to implementing it into curriculum. This year, Gail Armstrong and I conducted a study in collaboration with the National League for Nurses, where we surveyed nursing faculty to talk to them about their work with QSEN and how they integrated it. And what we found was that there is a huge variation in faculty's knowledge of the QSEN competencies and a huge variation in faculty's ability to attend educational opportunities to learn about QSEN, and this huge variation in how it's been integrated, and really an overarching need for ideas of how to do this. So the result of this is that integration of QSEN has been segmental, meaning it's in this course, but it's not in that course, or it's presented on this day, but it's not looked at the rest of the semester. So we really need to move away from that and to try to get it to be an underpinning where it's part of everything that we do. In addition, as educators, we know what quality and safety are. We've been teaching it forever, but the language and the approach to it have completely changed, and we need to update our skills so that we are using that current approach and that current language. Another challenge is the fact that we are all driven by NCLEX. As much as we hate to teach to the test, the truth of the matter is that most of us have that as a program outcome. And so we need for our students to pass that NCLEX exam. That is the purpose of the work that we do. So we are constantly balancing the need for NCLEX-driven material along with real-life experiences. There is an increased demand on faculty time. We know that that is a challenge to integrating QSEN. All of us have our faculty jobs. Many of us then have practice jobs, and then we have our scholarship work on top of that. So it's difficult from time to time to create activities for students or to create meaningful learning opportunities. So we know that faculty are seeking more resources and strategies. They want this packaged some way. And then the final thing that's really making this a challenge is that we don't have a lot of outcome measurements. We don't know how to figure out if students are learning this in school. We don't know how to measure this once they move into practice. And we are working toward that, but we haven't gotten there yet. So on this next slide, we can see where QSEN is at. This is a picture from our website. Every year since 2009, we've had an annual forum where we gather groups of educators from clinical practice and from academia, and we share teaching strategies and we share ideas for how to make this meaningful to students and to nurses. We have this year developed QSEN regional centers, 8 different places around the country that service that region of the country and therefore can provide face-to-face interaction and help people to be more involved with QSEN work. In addition, if you'll go to the next slide, we have a teaching strategy site on our website. So this is a repository for quality and safety education teaching strategies. And listed there are about 150. This is just a snapshot of the most current. But if you go into the website, you can download any one of these. And when you click on it, it tells you what it's about and how to implement it. And it gives you all the resources to download. For instance, if it's a PowerPoint presentation, the slides are there for you to download. And you can take any one of those teaching strategies and you can change it if you need to so that it fits into your course or into your curriculum. And all that we ask is that you acknowledge the person who originally created the material. So those resources are there for everyone, in addition to, published papers that have been written about QSEN and links to different websites that are connected to QSEN, like the IHI, the AHRQ. All of their resources can be linked through the QSEN website. So if you go to the next slide, even with all of this, we are having trouble connecting the dots, and we need to connect the dots because educators are still struggling with how to do this, and educators need resources, and we know that there's curriculums that are not including this, which takes us to the next piece of this presentation to talk about virtual learning strategies and the QSEN competencies. So we have moved into an era where we use simulation. If you go to the next slide, Chris, there are some resources here that I want to just talk about very briefly. So this whole idea of the student designation limiting learning, that has been documented in the research, but we know for a fact it's happening in practice. Just this last year in August, I got notice that one of my clinical groups was going to a hospital that was no longer going to let students access the electronic health record. So I teach senior med surg. How do you take students to a hospital when they can't access the health record? So we know that student designation definitely limits it. Everybody has seen work by Jeffries. She has written so much about simulation, and her work really demonstrates that it's efficient, it's safe, it's cost effective. Duff made a very interesting point. She said that when you do simulation in real time and you have students there live, you have positions for maybe 4 or 5 actors to take a role and to think on their feet and participate in the simulation. And everybody else in your group then becomes an observer and gives feedback, which is well and good, but those observers are not really put on the spot to think or to function in a nursing role. When we use online simulation, that's one-on-one. The student sits at the computer and they're interacting with that patient, and they have to think on their feet and they have to make decisions. So she indicates that online simulation is actually superior to traditional simulation. On the next slide, we really talk about QSEN in simulation. So ever since QSEN really got its legs and began moving, Cronenwett, Sherwood, and Gelman started to talk about how simulation is a very effective way to teach the QSEN competencies. And nobody's going to argue with House that patient safety needs to be addressed and reinforced throughout the nursing curricula. So it's going to be leveled at different areas of the curriculum, but it needs to start at the beginning and continue all the way through. And then Kalela, she says that, when you use simulation to teach the QSEN competencies, it creates opportunities that the student may not get when they're at the clinical setting. And because when you go to clinical, it's by chance that your student gets an opportunity to think about these competencies. But when you create something that they have to interact with it through a simulation, then it makes those opportunities evident for them, and they get that opportunity to have an exposure. Thus, the partnership between Shadow Health and QSEN, it's a wonderful way for Shadow Health to share its resources and a wonderful way for QSEN to be integrated throughout the curriculum. So Shadow Health is a screen-based high-fidelity simulation, and the QSEN competencies are mapped throughout those simulations. How Shadow Health works, it's a natural language conversation engine. So there's many different responses that virtual patient can give to the student depending on what the student asks that patient. So the conversation can go one way, it can go another way. It all depends on how that student steers it, which is a great thing for us as educators to watch how that student takes control and steers that patient's answers so that they get the information that they need. Along with collecting that subjective data through an interview, it gives the student an opportunity to do a detailed digital physical exam. So the student is doing what they would do with an actual person. In addition, it grades the student. So there is a student performance index so that A student can take it multiple times and can watch their performance improve. A faculty member can grade a student based on their interaction. So this is a great way for students to learn and a great way for us to measure it. QSEN's relationship with this is that we provide content advising. So we are identifying areas where QSEN can be embedded into these subjective interviews and into these physical examinations. We are increasing the focus on quality and safety in these presentations that they offer, and the process of which students go through to have that interview is based on quality and safety. And then we are connecting it to current resources that practitioners use. For instance, a student might never be familiar with the Beers list, but through simulation, the student will become familiar with the Beers list because that is part of the interaction that they're going to have while they interact with the patient on some of these clinical experiences. So this partnership brings these two things together. So if we could go to the next, okay, Shadow Health assignments. The QSEN experts and the Shadow Health have mapped the KSAs to performance indicators. So what this has allowed is that the student has the ability to interview the patient and gather subjective data. The student has the ability to collect the objective data, and then they have an opportunity to respond and be empathetic or to teach the patient if the patient needs teaching. So if the patient should tell a student that they don't understand something, the student can respond with teaching, and that shows up on this student's mapping through their program, and the educator can see, well, they took an opportunity here to step up and do the teaching when it was time. They are not scored on QSEN. On the QSEN part of this, they get feedback. So if we can go to the next slide, Chris. So what happens in relation to the QSEN part of this is when the simulation begins, the student will have an opportunity to be introduced to quality and safety, and they'll be told, you know, we're going to think about this as you move through this, and at the end, we're going to give you feedback and give you an opportunity to think about it. So that's what it looks like when it starts. In the next phase, the student will get the feedback on the subjective data that they collected. So it'll list the QSEN competency, for instance, patient-centered care, and then it'll talk about what the student did or didn't do that was addressed to patient-centered care, so the student can get feedback and learn from it. And then on the final screen, they'll get the objective data collection piece feedback. So this is where they did their assessment, and it'll tell them you charted it well, or you charted it appropriately, or you did a great job protecting the patient's privacy. So it gives very clear feedback about those aspects. The final page is about the education and empathy piece. And here it measures the student's ability to step up and do what they need to do when there was an opportunity. And the beautiful thing about this is that you can really see progression. Like if you use this with a beginning student, their scores are not going to be as high, and their feedback is going to be more detailed about what they need to include and what they need to change. But when you see the progression as students do this as seniors, you see a much more enlightened student who's giving education, providing empathy for the patient. For instance, if the patient says, I've been in pain, and the student says, I'm sorry that you've had that, tell me what has been happening. That's an empathetic response. And so the student gets that feedback that they're doing that piece. So at this point, I think that we're going to go to Nancy Ebersol. Is that correct, Chris?